Okay, good morning everyone. Today in our hospital we have guests from South Korea. Could you please be so kind and introduce yourselves and give a brief overview of your medical background?
Yes, I'm Chang Wook Jeong from Seoul, Korea. I'm a uro-oncologist and work for Seoul National University College of Medicine and Seoul National University Hospital. And I'm also serve as Chief Information Officer of our hospital.
Mm. Hello, good morning. I'm Dr. Choo Min Soo. I also from Korea, Seoul, and I work in same Seoul National University College of Medicine and Borame Medical Center. I'm a center of stone surgery.
Well, thank you for accepting my invitation. And today in our studio we also have Dr. Ulanbek Janbyrbekuly. He's a associate professor, PhD in urology here in Kazakhstan. And my name is Farkhad. I'm a vascular surgeon, associate professor and PhD here in Kazakhstan Medical University. So I made a list of questions, and first question is, could you please tell us about medicine and healthcare in South Korea, and how is it different from other countries, including Kazakhstan?
Okay, South Korea's healthcare system has a few key features. Firstly, most everyone in the country is covered under one national health insurance plan. This means that everyone can get medical care with they need it whenever and wherever. And
Totally free.
not free, but it's almost covered by our government. For example, if the patient diagnosed as cancer, the patient only pay co-pay about 5% of the all medical cost.
And do they pay something monthly? Do they pay something monthly? Like here, people have to pay every month, like small payment, and then they're covered with insurance. Then they're covered. Do they pay something for the insurance in Korea?
Yes, for workers, they have to pay to our national insurance monthly. Yeah.
Is it obligatory? Okay. And how is the mentality of Korean patients? Is it different from other countries? Like I've been in United States and other countries, and in that countries mentality, they have a different mentality from here. For example, here, one thing that I noticed, like I studied abroad, and I noticed that in some countries patients are very respectful to their health and doctors, and they care about their health. Like in our country we have a 50-50 situation. Some people do care about their health, but some people think that it's not their problem. Like if something happens, they go to the doctor and then it's their doctor's problem. So do they take the responsibility for their health?
Most Korean patients very respect to doctors because doctor we Korean people call the doctor the like teacher. In Korea, teacher is same level of father.
What is the Korean word?
선생님.
Teacher and father is same respect level in Korea. But some recently some patient, not most patient, some patient okay, is medical problem responsibility to the doctor. So some complain to, but it go to the legal problem.
Okay,
And
but do you have insurance for doctors that protects doctors in case if something happens? Like in United States, the doctors are covered if something happens. If patient file a complaint, it's not a doctor's problem, it's just a insurance company's problem. But here, it's doctor's problem. How about in Korea?
I think that kind of advanced system has not been established in Korea too, and more important thing is the the rate of charging to a doctor has been very high compared to the United States. So the inevitable department such as trauma surgery or very the surgical field, which should have a very high rate of complication, or pediatrics, the applicants to that kind of field has been rapidly decreasing now.
So, as you are urology doctors, I have some questions regarding urological conditions. Let's start with first one. What is a kidney stone disease and what are the causes?
Stone disease is the mineral crystal in 그 supersaturated minerals in urinary tract of kidney. Then we call it a stone. Like it seemed like a stone, so we called it kidney stone. That causes any state of supersaturated environment, like low water or high minerals, and so on.
The question about how kidney stones diagnosed in Korea. Maybe there is some programs or checkup system to reveal such kind of situations, kidney stones or something else at the earlier stages.
Most Korean regularly check the health status. It is very, very, very good medical system in Korea. So some kidney stone is regularly checked by regularly medical check system. But some patient or young patient, we usually check the over the 48 years old aged, but younger patient is not checked. So some patient has symptoms, some like gross hematuria or flank pain, like that.
Many Koreans takes a regular screening for general health in either in a private sector or national screening program. They always provide urinalysis. So if there are some pyuria or hematuria, they been sent to the urologist. So that's the one good method to find that kind of urinary tract disease.
Okay, as I know, there are different types of stones depending on the size and on the structure. So could you tell us about the classification of the stones and how do you manage kidney stones in South Korea? How do you treat this disease in South Korea? And is there any differences from other countries? And maybe you have some new innovations in your university?
I mostly treat by several guidelines. So most patients treated by standard treatment, 그, same the worldwide guide.
So it's like official government guidelines, right? Or is it international?
International AUA or EAU guideline. We also have our Korean guideline. Also have. We just accept very
proven
proven method.
네.
So scientifically proven.
And
Grade A.
and but I think we did we perform more flexible ureteroscopic surgery or combined retrograde and antegrade surgery, or that kind of a new surgical method. We lead that kind of field. And also one of my colleagues is involved in the clinical trial for the robotic flexible ureteroscopic system to treat kidney surgery.
Our hospital is very rapidly accept if the method is proven. So, 네. very rapidly accept.
The same here. Okay, and what advices could you give to patients who have kidney stone disease?
Most important preventive method is drinking water. It is very important.
Is there a formula of how much people should drink?
About 1.5 liter per day. Daily.
24 hours.
At
least.
Okay.
Yeah, but to patients, it's easy to say the urine should be clear, not darkish. Yeah.
And in urology, probably the most popular problem is prostate gland diseases. And among prostate gland diseases, as I know, you also do the oncologic surgery. And how often do you treat prostate gland cancer?
Okay. According to the latest cancer statistics in Korea, prostate cancer is the fourth most common man's cancer in Korea. However, it's increasing rapidly, so it is expected to be the most common cancer very soon, based on expected projected statistics.
But why does it grow so rapidly? What are the causes? Is it infection?
No, there are three main reasons. The first one is the westernized health style, including the food. Yeah, and the second is Korea has one of the longest longevity in the world. So aging is a very important factor to get a cancer, including prostate cancer. And the third is widespread of screening test, PSA, prostate specific antigen. It's still under use compared to Western country, but many private screening tests provide PSA. So that's yeah. Those are the main factors for the statistics.
And could you tell us about early signs of prostate gland cancer? How can it be diagnosed on early stages?
Early stage prostate cancer has no symptoms. So only advanced prostate cancer make urinary symptom, such as hard to pee or frequency and nocturia, weak stream. But the metastatic cancer also can make related symptoms at the metastatic site. For example, pain in the back or at any body part.
Okay, I see. And is there like a blood test to make a diagnosis on early stages?
Yes, the blood test called PSA, prostate specific antigen, is a simple screening method, and we recommend it since 45 or 50-year-old annually. Yeah. However, if the man has a family history, such as a father or uncle may have a prostate cancer, the risk of prostate cancer is a double or 5 times higher. So, in that case, we recommend start this kind of a screening since 40 years old. Yeah,
Annually or maybe 2 times a year?
annually. Yeah.
And what are the treatment options for prostate gland cancer in South Korea, and especially depending on the stages?
Yes, the characteristics and the aggressiveness of prostate cancer varies by the patient. Sometimes it's very indolent, and it cannot make a problem for rest of life, but sometimes it is diagnosed as a metastatic cancer and make a serious problem and make a mortality in 5 years. So the treatment should be tailored to the patient. For localized prostate cancer, the definitive treatment is surgery or radiation treatment. But in a very low risk cancer, it is managed by active surveillance. It's regular check by biopsy annually or biannually to monitor the cancer progress or not. That kind of active surveillance provide delayed treatment to make the patient avoid unnecessary complication for a long time, or half of the patient can live without treatment for rest of his life. And surgery, radical prostatectomy, can be performed by open surgery, laparoscopic surgery, or robotic surgery. But prostate locates very deep in the pelvis, so it's very hard to approach and hard to see in the open surgery. So the that kind of reason make the robotic surgery is very popular in prostate cancer. So in fact, the outcomes is much better than the in robotic surgery compared to open surgery. So recently, almost 95% of patients received robotic radical prostatectomy in Korea. And radiation therapy is another option for cure the localized cancer, but it has a higher chance to recurrence compared to surgery. And complication can be accumulated in the late phase, 5 years, 10 years, 15 years later, it can be a serious complication. So we recommend this kind of radiation therapy to only to elderly men or have severe comorbidities.
Okay, and what kind of robotic device do you use? Da Vinci?
Yes, we use a Da Vinci system, and we in Korea we also have a Revo Eye, the mirror company developed, and recently Medtronic Hugo RAS system has been approved by Korean regulatory. Yeah.
So, what are the side effects of those mentioned treatment methods?
The functional side effects are very important to patient. The incontinence and erectile dysfunction. It could be a problem to patient. Even in surgery or radiation, it can be happen. And yeah, but recent data show almost 90% of patients recovered the continence, so they can live without a pad or diaper, but last of 10% of patients may keep their diaper after surgery, and erectile function depends on the pre-treatment previous condition of the sexual function, and young and potent man can easily recover his sexual function, but the elderly man it's very hard to recover it.
Do they need additional like testosterone replacement therapy or something?
No, testosterone is a good field to prostate cancer, so it's not given.
So, what advices could you give to the patients who have prostate gland cancer?
Prostate cancer can make recurrence or make a problem in a very late phase, such as 10 years later or 15 years later. So patient should check PSA test regularly after the surgery or treatment, almost all for their whole life. Yeah.
I heard you have some new methods invented by you. Could we discuss them?
Okay. I've been working on this development about for 10 years, and we developed a new medical device which can cure hypertension. The current indication is resistant hypertension who has uncontrolled hypertension, even taking 3 or more antihypertensive drugs. The many companies developed intravascular renal denervation. I mean the kidney is very important, has a very important role to control hypertension. So hyperactivity of renal sympathetic tone is very important for making that kind of a resistant hypertension. So blocking the renal nerve can be a treatment. So many companies try to make that kind of technology from the inside of the renal artery. It's a catheter-based approach. Last year, FDA approved 2 devices, but efficacy is very low. Compared to control group, the treated patient has only about 4 to 5 millimeter mercury the benefit. But we developed extravascular approach. It can completely ablate the whole the renal nerve, and it can give a dramatic effect of the BP control. Currently, we are on the first in human trial in Korea, and we recently got approval from FDA for a clinical trial in the United States. From the early experience of first human trial, it's almost the miracle. One patient who takes 7 antihypertensive drugs, even that kind of treatment, she experienced over than 200 millimeter mercury in systolic BP, and repeatedly admitted by hypertensive crisis. But after taking this procedure, since the next morning, her BP dropped to 80.
Wow.
And
Systolic.
yeah, systolic BP was 80 millimeter mercury. 60 about. So as a protocol, we quit 2 antihypertensive drugs, and after 1 month, her systolic BP is 108 millimeter mercury. It's stable. So if it maintained to 3 months, we can quit more drugs for her.
So now, how many antihypertensive drugs she
5.
takes?
5. Yeah.
So you are expecting to reduce the number
More.
of drugs to
Yeah.
4 or 2?
It depends on the result at 3 months. Yeah, because the protocol, we can not change the antihypertensive drug number of antihypertensive drug during the follow-up period. So after 3 months, we can reduce more.
So hopefully, when do you think this method will be available to the market?
Market?
To the market, right?
It takes
Approximately, right?
more
How many years?
more than 5 years,
I know.
because we finished
You don't know
the
long-time results, right?
we need to perform feasibility study, and after getting the result, we also perform the multi-center, multinational confirmatory trial, and it will take several years. So to get a full approval, I expect it's more than 5 years.
Okay. So, as a doctor in South Korea, what difficulties do you face in your healthcare system?
National insurance system is very good some side, but it is very old system. So recently appeared some significant problems, like very low payment for doctor. Low payment doctor is most important problem nowadays in Korea.
Wow, I didn't know about it. So, what are the average salary of the surgeon in South Korea? What is the average salary and average payment For example, for the beginner surgeon.
Compensation is not enough to the doctors in necessary field. But out of the general hospital, there have many private clinic for cosmetics or unnecessary field. The compensation gap between to private and the public sector very widen now. So the many young doctors leaks to the private sector. That's the very big problem. And in addition, compensations to doctors in very hard condition and very easy condition is almost same. For example, surgeons who did a very who do a very difficult surgery and devote their life to the patient is almost same with doctors having very easy jobs. So, and many doctors want to be a very easygoing job. Now, that is most big challenging in Korean healthcare system. But so we request to increase the coverage to that kind of necessary field, but the government just want to increase number of doctors, making will prove that kind of issue. It's a very simple and stupid idea. When the when the number of doctor increase, somebody will do that job. It's a very ridiculous thinking.
So they are losing the dedicated doctors. So we have a same problem here. Like in government hospitals, they pay little amount of money, but you do a very large surgeries, big surgeries, challenging surgeries. So lots of surgeons quit their job, whether they switch to the private clinic where they can earn money, or they go to other job or abroad.
Many countries have same problem.
Okay, so we almost finished, and I have one question from myself. Maybe it's not for the video, just I'm curious. You have a family, right? You have kids. In future, do you want them to be doctors or not?
I don't know.
Like if they ask you, Father, should I go to the medical university? Because
Yeah.
I don't know how to answer this question.
Until last year, I will recommend to be a doctor. But
And after last year?
the February of this year, our government just announced they will increase number of medical students in 40% without any preparation and without any the proper calculation or proper communication with our the specialists. And we request just sit down and recalculate how many we need. But they don't listen. Just increase 2,000 medical students. If you don't follow this order, we will charge you. That kind of struggle is ongoing in Korea now. So it's very hard to say, but it's they put the oil in the fire because our healthcare system is already collapsing now, and they accelerate it. Yeah, so if this situation continues, I will not recommend to be a medical doctor in Korea, but in the United States.
But in the United States, they have the same problem. Like I spoke to one doctor from the United States. He's a surgeon, and he told me we in like 10 years we will have a deficit of a lot of doctors specialties. And what they do now, they have replaced doctors with nurse practitioner. There is a job. It's called nurse practitioner. It's basically the nurse, but she prescribes everything as a doctor. But maybe in hard cases, she goes to ask the doctor. Otherwise, she can handle it herself. Like she or he handle it themselves. So I don't think that's a good solution.
But
I think it's good.
but the difference is the quality of life in the United States, in Korea. We walk, for example, myself, I walk from 7 to almost 11 or 10 p.m. From 7 in the morning and 10 or 11 at night, I work for my hospital. But in the United States, they just come in 7 and go at 4 p.m. or sometimes they don't come to hospital. And they have a very long vacation period.
You studied there, right?
I've been there for 1.5 year as a visiting scholar.
Where?
UCSF.
UCSF.
Yes, University of California, San Francisco.
Well, I've been in University of California, LA, UCLA.
Uh,
How about your work-life balance? Do you think you should improve it? Like, for example, myself, I used to work a lot, and sometimes I work a lot from 8 o'clock till late evening, 8, 9 o'clock of evening. And one time I went to vacation, 2 weeks of vacation, holidays, and when I came back, I realized just my life is only in the hospital. I don't see people, I don't see my relatives, I don't see my family, and I decided to try to change it because life is going and I'm not getting younger. So maybe I should spend more time enjoying life, not just hardly working, pushing myself. What do you think about it? About for yourself?
Our health system cannot support that kind of work-life balance because the compensation to hospital is too small. Even surgery field is below the cost. So in that kind of system, we have to see a lot of patients and we perform a lot of surgery.
But how about if you switch to private sector? How about if you switch to private sector, private company? Did you consider this?
I think it is very good.
It's a
way.
good way to earn a lot of money, but it also takes a lot of times and devotion to the clinic. It's almost the owner of some small 뭐라 그러나 가게, small store. If we close several days, they have to pay a lot. So it's very hard to have vacations. Yeah.
But if you, it's in case if you open your own private clinic, right? But if you work for someone else, like
Yes. Somebody.
like here we have options to work in government hospital and do the work in private hospital.
Yeah.
People usually combine. Do you have that option? That option?
Recently, some professors at the medical university go to the secondary hospital and pay him more, and no responsibility for education or making research. Yeah.
Okay, it was just questions for myself because I'm curious. As a doctor, I face same problems, you know, and I worked a lot of in government sector. I worked in like President Affairs Hospital everywhere, and then I realized that they don't pay me enough money. I don't have good work-life balance. So then I started to combine, just for myself. But the answer was good actually. So maybe if you're not against it, we can keep it in video. So okay, thank you for visiting us today. Thank you for joining us. Is there anything else you just could say to our listeners?
We have to worry about our health. We need to protect our health by ourselves. We have to always think healthy lifestyle, and the regular checkup is very important.
I do not answer to your self question yourself.
Yes.
And if he or her want, I recommend that because doctor is very good job
Yes,
for people.
doctor is very important and good professional.
Okay.
We can help some people.
But would you insist to your child to go to the university, medical university, or no? Would you insist, like, you
If
have
she
to
want,
go?
she or her he want,
Only if she or he wants.
I would like to recommend to go United States.
Okay. Okay, thank you for joining us today. See you later. We will finish for today. Thanks for everyone. Goodbye.
Yeah, спасибо.